Hello everyone and welcome to Africanews. COVID-19 in Africa, 1 year on, impact and prospect. Such is the name of the 2021 report published by Mo Ibrahim Foundation ahead of the Ibrahim Forum, an annual event held in early June and attended by leaders of the African continent. For 3 days, they explored the health, economic, social and political impact of the pandemic in Africa. Among the speakers at this forum was African Center for Disease Control and Prevention Director John Nkengasong. Is my guest today on Africanews. Good morning, Doctor.
Bonjour.
Good morning.
To what extent has the COVID-19 crisis weakened the African continent?
The COVID-19 crisis has affected Africa a lot, especially in terms of health. Today, there are about 140,000 deaths. Some tend to think that Africa has not been seriously affected by the virus compared to other regions of the world. But this is not the case. 140,000 people have died. That is a lot in only 18 months.
It seems the strengthening of African capacities has become a priority. How can this be done, and what are, in your opinion, the essential measures to be implemented?
There are at least 4 areas where Africans, in partnership with our collaborators, must really focus their energy. First, focus especially on the strengthening of our capacities in terms of our public health institutions to effectively fight this pandemic. Second, we must ensure that the training of our health workers is increased. Today, in Africa, there are less than 3 million health workers. This is very few compared to a continent with 1.2 billion people. Africa must be able to manufacture vaccines, diagnostic tests, and medicine. So, Africa must change all of this to be able to prepare itself to fight against this pandemic, but also against the pandemic to come.
Let's talk about vaccine distribution. Does Africa have a real continental strategy? What is the status of AVAT initiative?
AVAT initiative has been very successful in that at least 400 million doses of Johnson & Johnson vaccines have been purchased. So with this initiative, I think we're going to restart the immunization program on the continent within the coming weeks. But 400 million doses of vaccines will not allow us to vaccinate 60% of the population, as we hoped. Close collaboration with the COVAX initiative is still necessary and important.
How do you think the situation will evolve on the continent in the short and long term?
We are going through a very difficult time, as at least 20 countries are currently experiencing a third wave. And the severity of infections is more worrying compared to the second wave. This means that if the vaccine does not arrive, if the continent does not manage to immunize the population in time, Africa will continue to have difficulties in controlling the pandemic.
Not all regions of Africa are affected in the same way. Could you give us an overview of the situation if we talk about North Africa, Sub-Saharan Africa, for example?
We can see that Southern Africa, especially now, is seeing a significant increase, perhaps because the sub-region is in the middle of summer. People do not go out easily, they stay indoors. So we can see that there is a huge increase in countries like South Africa, Namibia, Zambia, and that there is also an important increase in North Africa as well. On the other hand, in Central Africa and West Africa, we continue to see a decrease in infection rates. So the 5 regions of Africa are not affected in the same way.
Does the focus on COVID-19 jeopardize involvement in the fight against the continent's biggest killers, malaria, tuberculosis and AIDS?
It's obvious that the fight against these diseases has been impacted. Diseases like HIV, where there has been a decrease of maybe 40% in testing rates since last year. For sure, there will be a huge impact on these 3 diseases, namely malaria, TB and HIV.
Thank you very much for being with us on Africanews.
Thank you very much.